Morning, everyone. This podcast is sponsored by Optimal Health Bridge and FullBodyHealing.com. Today, our guest is Dr. Harry Elwart. I hope I'm pronouncing that correctly.
That is correct.
I'm honored to have time with you today, Dr. Harry. You earned a degree in naturopathic medicine and a PhD in health and nutrition, which is rather amazing. And from what I understand, you've been concentrating on heart disease for over 20 years. Dr. Harry, I should say, that's the way you're called on the website, is a formulator and a researcher and introduces products, health-based products that I can attest get really amazing results. So an author, a lecturer. Dr. Harry, welcome to the podcast. How are you?
It's great to be here. I'm looking forward to it.
So for those of you watching this video, I met Dr. Harry through a referral from another doctor in regards to my own heart health. I have familial heart disease. And recently I had a CT scan about 6-7 months ago that got me really worried. These medical tests, I tell you. And a lot of fear developed, I think it was like medically induced fear. And Dr. Harry has absolutely turned my thinking around. I'm really happy you're here. Dr. Harry, I've got your book. I've gone through it twice. It's a really important book, Let's Stop the #1 Killer of Americans Today. And you wrote that in 2012. And unfortunately, everything you said in the book about heart disease is still true today, 9 years later, and maybe it's gotten even worse. How is it that mainstream medicine is missing the mark so poorly, and how do you view things in 2021?
Well, mainstream medicine has not changed, and even with the introduction of new technology and new drugs, we're losing the war on heart disease, and that will continue. The idea that pharmacology, as well as cut, poison, and burn, is not working. And for that reason, we are losing the war. But, you can change your life by just changing your strategy and making different decisions than what you're taught in Western medicine. Yeah, what's really going to surprise you is what got me involved in what I'm doing now is Amway.
Oh my God.
I got involved in Amway and Neutralite, which is their vitamins and different things. I was just impressed on how they work for people. I left Amway, went to another network marketing company, and they had some things that I was a UPS driver at the time, and I would give these couple pills to people on my route, and they'd come back the next day, oh, get me more of those. It was almost like I had cocaine or something. So then I said, well, I got to go back to school and find out why these things work. So I went back to school at night and got a certificate in nutritional counseling, a master's in herbology. And then I went on to get my doctorate in naturopathy. And for my dissertation, I decided to do heart disease because I was realizing that it was the #1 killer, that it continued year after year to be the #1 killer. I wanted to know why. And so then my dissertation was on natural cures for reversing heart disease. And right after that, I got hired by a pharmaceutical company, which kind of sounds weird, but they created their own nutraceutical division because they had purchased the rights to a product called Heart Bar, which contained an ingredient called Arginine. And they paid $83 million for the right to sell this Heart Bar from a doctor who was chief of vascular medicine at Stanford University, Dr. John Cook. And we were doing great. I mean, my job was to go out and educate doctors about, what arginine-derived nitric oxide was doing as far as reversing heart disease. We gave them the free samples, buy them lunch, the typical pharmaceutical route. And it never really caught on, but it did catch on in general public. But then we got in trouble with the FDA and FTC because when John Cook sold it to us, he sold it as a medical food. Well, a medical food is something that you don't need a prescription for, but it has to be FDA approved, much like a drug. Well, when John Cook submitted the paperwork, he never heard back, so he then automatically said, well, it's a medical food. Well, it was never approved as a medical food. So then everything, we had to shut down everything, our website, our brochures, our labeling, everything got shut down. And that $83 million investment turned into a white elephant. And after a year, I left there and started doing similar formulas for other companies, mostly network marketing companies. And then in 2009, I said, you know what? I've had it with these companies. I'm going to do my own. So I created my best product yet and launched the Health Guardian, and we've been going gangbusters ever since.
In the book, you went from the dedication to jumping right into heart disease. And my last 15 years, I've been involved in baby boomer health, wellness, and heart disease is the big one. So it's not just an American problem. It's actually heart disease is killing more people than anything all over the world.
All over the world.
I think I'm your perfect patient. My own personal lipid profile, I went from 508 triglyceride score milligrams per deciliter down to 200 using fish oil. And I thought, this is the magic elixir. And I actually went into business promoting omega-3 fish oil.
Okay.
I couldn't get my triglycerides under 200. I think I did it once, one test that came out 158. But the LDL and the HDL has always been low. So I feel like with that CT scan, trying to figure out why my numbers won't change. And then even having those numbers as a target, when I read your book, I kind of realized that that might not even be the right target to be aiming for. And I think you talked about doctoring, how doctors, they doctor by the numbers. They're trying to fit the patient into a number.
Yeah, absolutely. Every drug that they recommend is based to lower a number. It's not based on, okay, here's a symptom, let's correct this symptom, or let's correct the problem. They try to correct the symptom. But what's causing the symptom? They don't correct that. So yeah, and taking fish oil was actually great. There was a doctor, Dr. Dwight Lundell. He was a famous heart surgeon, and he basically said, you know, what's happening is we're telling people, you know, low fat diet and take your statin, and more people will die this year from heart disease than last year. So we're failing miserably. And he actually walked away from his practice, and he was a famous heart surgeon in Scottsdale, Arizona, or Phoenix, Arizona, one of the top heart hospitals in the country. And he treated his patients by using fish oil because he realized that cholesterol was a problem, but in 50% of the people that were dying of heart disease or going under the knife, it was inflammation. And it was inflammation that was causing the swelling of the arteries and cutting off the blood flow to the heart. And what treated the inflammation was not statins and low fat diet, it was actually omega-3s. So by you taking omega-3s, you were on your way to healing yourself.
I have no doubt that I've been on the right track and doing all the right things, but that last bit, and then of course, when I did go to see a cardiologist, which may have been one of the biggest mistakes I ever made in my life.
Right.
They ordered the CT scan and it showed a coronary calcium score that was quite high.
Yeah.
And of course, reading the report, it took every second or third word I had to look up and then try to piece the sentence together to make sense. The doctors it seems like, to me, from my perspective, it seems like their aim is to put a fear in you so you take the statins, basically.
Right.
That's what it amounted to. And then when I sent you my blood report, you said my cholesterol is kind of right in the right range for my age. Is that correct?
That is absolutely correct. 230 plus your age would be the high end. If it got up to there, then you need to do something like take red yeast rice or something like that, not a statin. So I'm not sure, you're 60 some years old, so that would be almost 300, you know, so you're nowhere near that. The older you are, the higher your number should be. Your blood pressure is higher, your cholesterol numbers are higher, everything's higher when you are older. Your brain is 78% cholesterol. I just got on Medicare, and I went for my annual checkup. I haven't been to a doctor in 20 years, so I find some doctor that my son-in-law went to, and he comes back and says, well, your cholesterol is 178. We need to talk about a statin. Like, you got to be kidding me. I think that's low. It should be about 200, 220 at my age. Well, he didn't know. Another thing, I gave him a copy of my book the first time I went to meet him. And it was funny that he said to me, he says, I was reading through your book and I didn't realize that those drugs have such side effects. I'm like, what do they teach you in med school? Yeah, here's an pill, here's a pill, and that's it. Don't warn them about side effects. Oh my gosh, they might not take it. So yeah, it's all those numbers mean nothing. We're going to start talking about, I'm sure arginine drive nitric oxide, but your cholesterol could be 600. As long as it's not sticking to the blood vessel wall, it's not a problem. Now, taking a statin blocks your liver from producing cholesterol, as well as CoQ10, which is also important for your heart. But what happens is it's still sticking to the blood vessel wall. Maybe not as much, but it is still. So there's no evidence that it actually will prevent a heart attack. Taking arginine drive nitric oxide, that LDL cholesterol, when it oxidizes, sticks to the blood vessel wall. Well, what happens is taking arginine drive nitric oxide, it doesn't oxidize. So it could be 300, as long as it's not sticking to the blood vessel wall. There's a reason why your liver is producing it. Maybe your body needs it elsewhere, in the immune system, in the sexual system, in the whatever, your brain system. But your body knows what it's doing, as long as it's not sticking to that blood, to that artery wall, which is called atherosclerosis.
So I equated a high calcium score as blockages, not knowing. I met another medical doctor who was involved in the functional medicine world, and he said his mother passed at 93, and she had calcium all over her body. She never had a blockage.
Oh wow, yeah.
So it doesn't. We assume calcium means blockages, but actually, I think the way the cholesterol works in the arteries is when there is an inflammation, an event where there's a little crack in the artery and a molecule of blood tries to escape, the immune system rushes in with all this cholesterol to help patch it up and heal you, right? So the cholesterol's there actually to heal you.
Correct.
Yeah.
And then the calcium hardens it. And over time, that patch gets bigger and bigger and bigger until it cuts off the blood flow and you have coronary artery disease or carotid artery disease. So, but yeah, if you can reverse that procedure, then there's nothing to worry about. So calcium scores are important, but you can take vitamin K. Vitamin K2 is all you need to keep that calcium from hardening and creating problems in the arteries.
Yeah. So in your book, you go through a lot of nutritional supplements. You give a lot of information on what medical tests there are, which ones are really required and which ones are not really required and are really too invasive. And then for me, when I got to the part of the book where you started talking about arginine and nitric oxide, it was like pulling a rabbit out of your hat. Like, all these supplements are good, but this is what you really need.
Right.
And that's, I don't think you name it in the book, but it's cardio for life, right?
Right. Yeah, I don't mention it in the book because, the FDA and Federal Trade Commission doesn't like to when you do that. So, but yeah, heart disease, there's 13 million people have coronary artery disease. That's from diet, that's from, lack of exercise. And what happens is the arteries become clogged and it cuts off oxygen to the blood, cuts off blood flow to the blood, and a person starts having chest pain. and they go to the doctor and then they have a stent or a bypass or whatever. But there's another form of heart disease that we really need to look at, and that's sudden cardiac death. Now, that's heart attack and sudden cardiac death are two different things. A heart attack is that slow process. Sudden cardiac death can happen to anyone, anywhere, at any age, and 300,000 people every year will die from sudden cardiac death, and that's from an electrical disturbance in the heart. That's why in my book I break down, we need a strategy that actually tests people before it's too late, because the first sign of anything wrong is death. Well, you don't get a second chance with death. So for 300,000 people, that's 1,000 people a day. That's 6 children or 6 children every week. That's 100,000 athletes every year that are dying from sudden cardiac death. That can be prevented through early detection. And unfortunately for sudden cardiac death, people don't test because they don't have anything wrong with them, and then they drop dead. Reggie Lewis played for the Boston Celtics in a game against Charlotte Hornets, collapsed and died, and or not died, but he had sudden cardiac attack, and the Boston Celtics commissioned 11 doctors and paid him $1 million each to keep him alive. They kept him alive. He got back on the court, and before the first game was warming up, collapsed a second time and died permanently. They couldn't bring him back. So it's something that's not to be played with. And, you know, we have devices now that are FDA approved that can detect, you know, I'll give you one. I see the commercial all the time, the Cardio Mobile or whatever, where you put your fingers on a couple of things and it shows your pattern. Well, if you are having an arrhythmia of some kind, there'll be a drop, you know, it'll be fine, and there'll be a drop. So you'll see that, and they should be putting these in to basketball games, football, you know, all the different things, because kids are dropping dead, and that can be prevented just by simple testing. So that's the first part of the strategy. Second part of the strategy is definitely, you know, supplementation, taking supplements. That you have to understand that every drug on the market today is based on something natural, something that God put here on the planet to cure people. Give an example, aspirin. Aspirin is a synthetic, it's a chemical, but it's based on white willow bark, which is the natural solution that God put here. But when you synthesize it and you make it a chemical, your body doesn't recognize it. It's a poison. It doesn't know what to do with it. Versus a plant, which is a food, your body knows exactly what to do with and how to get rid of it. And it's not stored in the kidney and liver, where you end up with kidney failure or liver failure farther down the line. So yeah, supplementation and early testing is the secret to longevity.
And in the hierarchy of supplements, we know fish oil's up there and Arginine, right? Those are the two. Would you say those are the main two? And then the CoQ10?
Arginine converts to nitric oxide. 3 gentlemen in 1998 won the Nobel Prize on what nitric oxide does as far as, you know, opening up the arteries, softening the arteries, for melting away plaque, lowering blood pressure, wonderful things. You're increasing your memory, your immune system. So Arginine-derived nitric oxide is key. And then, like I said before, Dr. Dwight Lindell said omega-3 for inflammation throughout the body takes care of that, which can also lead to the same symptoms. So yes, those two are key, but there's other things that a body needs. It needs the vitamin C, it needs the vitamin D, it needs vitamin E, it needs all the minerals and trace minerals. You don't get absorption of the vitamins without the minerals. So those minerals are important. CoQ10, your heart is a muscle, and every cell of your body has a mitochondria, which is a furnace, and needs CoQ10 is the fuel for the furnace. Resveratrol, you know, it's a antioxidant, but people that in the Mediterranean don't get a lot of heart disease and they drink a lot of wine. It's resveratrol in that wine that actually prevents heart disease. So yeah, there's a lot of different things that we can put together into a supplement and take all at once, and you're given protection, as well as it can reverse a lot of these symptoms or a lot of these challenges.
Yeah, I'm on my second jar. taking it twice a day, like you recommended. I'm very, very happy with it. So let's jump back a little bit. I know we kind of covered this, but just the whole Framington heart study, atherosclerosis, cholesterol theory, statins. I understand it's a multi-billion-dollar industry for the pharmaceutical companies. How is it that the things that you just said are not known? I mean, even I've met nurses who don't know about fish oil. It's amazing.
Well, fish oil is becoming popular, but not, it's now a pharmaceutical, Vasipa. You see commercials on television all the time. It's an expensive fish oil that, you can buy it for pennies on the dollar at Costco or Walgreens, but they want you to go and get a prescription that costs 100 times more, of a chemical that's similar to omega-3. But yeah, it's a billion-dollar industry. What they realized was they could test for cholesterol, and then they came up with a drug for cholesterol, and that's been all that a billion-dollar industry year after year after year. I mean, every time I go to the doctor, my wife goes to the doctor, that's all they talk about. Well, I'm taking it. You should be taking it too. No, you can keep on taking it, but no, statins lead to all kind of problems. They lead to diabetes. People that take statins will end up with type 2 diabetes. They lower your immune system. They reduce your sexual function. They can cause cancer. There's just a whole, your memory, Alzheimer's, dementia, because you're blocking cholesterol, which 78% of your brain is cholesterol. So now we have an epidemic of Alzheimer's. So yeah, taking that statin, sure, it lowers the number and everybody's happy, but it's not treating the real problem. And what the side effects, the risk is not outweigh the benefit. And that's what they always say. Well, the benefit outweighs the risk. Never believe that.
Right. The other very clever thing you put in your book was statistics on the number of people who died from taking supplements. 0.
Yeah. In fact, this year too, 0. Vitamins, minerals, herbs. I think one person died from an energy type drink or supplement or something like that, but it wasn't a vitamin or mineral or herb or anything like that. So, but yeah, year after year, and I just got it like 2 weeks ago. It just came out with a new study for 2020 that not one person during that whole year died from taking a supplement.
Last medical question, I think, before we might tackle another subject, but where is the room for Western medicine and naturopathic medicine to come together and agree on some things? Where is that sweet spot?
It's called complementary alternative medicine. And there are doctors out there. You can go to acam.org, Alpha Charlie, Alpha Mary, .org, and put in a zip code, and you can find a doctor in your area that believes in complementary alternative medicine. What they do is they will treat naturally, and then if they're not getting then they'll might give you a drug, versus starting off with a drug and poo-pooing anything that you tell them. Oh yeah, they'll either say, oh yeah, you can take this, or you're wasting your money, or you got expensive urine. Well, if you're taking drugs, you got very expensive urine because your body isn't absorbing all that drug. So yeah, so it's just that's about as close as you will. Osteopathic, chiropractic doctors will treat with natural first, but that's as close you'll get to the two combining, because number one, there's a lot more money in Western medicine, and that's what's feeding all the pharmaceutical companies, and as well as all the academies, the American Medical Association, the American Doctors Association. Who's paying their bills is the pharmaceutical companies, the media. Who's paying for ABC and NBC and CBS and all their advertising is the pharmaceutical companies. So it's never going to be the grand, marriage.
Right. I just finished a year's worth of studying functional medicine, where a lot of Western nurse practitioners, nurses, there was even a cardiologist in our group. It was more about functional medicine was more about finding the interconnectivity of things in the body, like maybe it's your ankle that's hurting, but is it really the ankle, or what's precipitating that, and where's it what organ is it really coming from,
Correct.
or what is the psycho part of it, the emotional trauma or stress that's resulting in this pain in the body. I read a lot Dr. John Sarno, who treated back pain and shoulder pain and hip and knee. He always sent them to therapy for 2 hours before he would even think about performing any kind of surgery, because we carry a lot of things from our past, from our childhood, that
Right.
erupt in the body over time, and we're completely unconscious of it. But the like there's memory all over the body, and some of that trauma still exists if we don't work on forgiving ourselves, forgiving our parents, all that sort of thing. So, because everyone in the entire world, maybe, especially what I see in America, people are really stressed and paranoid about this virus. So, can you speak to the stress level and the isolation that not just senior citizens are encountering, but even children not being able to go to school, and the stress that creates in the home for the mother who loses her job because there's no childcare for her child?
Well, I'm certainly no expert in that field, but I will say that it's very unhealthy. That's about all I could say about it. That not being able to socialize, not be able to function as a human being, and being strapped down to your Zoom calls and everything like that. Yeah, it's totally unhealthy and leads to other problems, and it is sad. Everywhere the blood flows, nitric oxide is produced, and it's a gas, and it burns off rather quickly. But the miracles happen as it burns off. Like, it takes with it, melts away some of the plaque. It widens the arteries, the veins, the capillaries, to increase blood flow. Anytime you increase blood flow, you're increasing oxygen. Oxygen is healing. So you're increasing that blood flow to the cell. It's delivering the oxygen, taking away the toxins, and it's a continual process. So the endothelial lining, or the fine lining on the inside walls of the arteries, veins, and capillaries, is where that nitric oxide is produced. So that's where the healing occurs throughout the body. Miracles are happening as long as we're giving our body what it needs to increase that oxygen and remove those toxins.
Yeah, it's a wonder to me that at any given moment we're processing billions of transactions in our body without even thinking about it.
Without even thinking.
It's just it's the autonomic nervous system. It's the natural state of health that we can enjoy and we should enjoy all the days of our lives. I believe.
Right.
The last part of this is so intriguing. When I went to the cardiologist and he told me about the calcium, I said, well, can you show me what this actually looks like if there's blockages? I run up the stairs, I swim 20 laps every day. Like, I don't have any symptoms. Where's the problem here? And he said, well, we can't tell you that without doing an angioplasty and putting a camera
Right.
and looking.
Right.
And then I meet you, and you tell me quite a different story. So tell me about smart pulse technology.
Well, there's something called digital pulse wave analysis. It's FDA approved. It's used all over the world. Unfortunately, most doctors are 10 years behind, technology, so they don't understand it. But what it does is you hook your finger up to something that looks like a pulse oximeter that measures oxygen, and just like that. And what it does is, as that blood comes to the fingertip and goes back, it's measuring the hemoglobin in the blood. And then by doing that, and by rating the speed and the velocity of that blood, it actually projects an algorithm that can be analyzed and can show the heart strength, much like, you know, a doctor would hook you up to a bunch of EKGs and different things like that. It will show the electrical system. It will show arteries as far as plaque buildup. I mean, it's not going to show the plaque itself, but it breaks you down from level 1 to level 7. Level 1 being excellent, level 7 being you better go see a doctor. You got problems. So by determining that, you can determine the arterial age of your arteries. And by determining the arterial age of your arteries, you can be a 60-year-old with 20-year-old arteries. You can be a 20-year-old with 60-year-old arteries. So by determining that, then, you know, we can use protocols like Cardio for Life, come back 30 days later and check the improvement of what's happening within those arteries, veins, and capillaries. It it shows heart strength. So that would be, you know, how strong is the heart in releasing that blood. Yes, it does show that. It also shows the sympathetic versus the parasympathetic. Sympathetic nervous system is your fight or flight. The parasympathetic is the relaxer. And you want to be balanced in that. It also shows your physical stress, mental stress, and stress resistance. You know, how are you willing to deal with stress? How able are you to deal with stress? Because stress is a killer. So in heart rate variability is communication between the brain and the heart. The brain and the thyroid control the heart. So it's important that that communication is functioning properly. So, you know, between the cardiovascular portion of that screening and the heart rate variability, and then also the stress, you get a pretty good synopsis of what's happening in your heart and your arteries.
So I'm going to go back now to your mission statement on your website, which I found to be the most encouraging thing that I've ever read. You say on your website that your mission, your job, is to take away the fear of a heart attack or a stroke. And that meant so much to me after being told nearly the exact opposite by Johns Hopkins, right? So
Right.
I'm very appreciative of that. I'm very appreciative of your mission.
Well, I think everybody does to a certain degree after you reach a certain age. Most people don't start considering things like this until they go and get tested, or maybe their blood pressure is elevated, or maybe now they've got type 2 diabetes, or maybe they feel a little flutter in the heart. Now all of a sudden, you know, this thing that's been beating 100,000 times a day, you don't give a second thought until all of a sudden it starts to flutter, and then, oh, what's going on there, you know? So, but yeah, it's it's something that is quite common, and I think that's a fear tactic that doctors use. You know, that if you don't, you know, come back and see me and take my drugs, and we talk about possibly doing a stent or a bypass, you're going to die. Oh, excuse me. There's got to be other options, and there are other options. They just don't want you to know about them.
It's puzzling to me. I know doctors have, it's a lot of work, it's a lot of cost to become a doctor, and most doctors I've met have really good intentions. It's just they're trained in a certain way, and they're too busy to see outside of that. They've got too much work to do.
Right.
It's 7 to 9 minutes with a patient, and they have to move on. And that was really the struggle with the functional medicine idea, is you cannot have a doctor sit with a patient for 2 or 3 hours taking their full health history and making that interconnectedness roadmap of what's really going on inside of them. That takes, and that's why I'm a health coach, and that's why health coaches are needed right now, because there's got to be somebody who's certified to ask the questions, record the data, let the doctor look it over and then make a decision about complementary medicine or our drugs indicated. So I know for intervention, for broken bones, for car accidents, doctors are absolutely critical in this time of pandemic. Uh, they've been on the front lines dealing with a lot of really tough stuff.
Right.
So I give them a lot of credit, but I don't want to be told to throw my supplements away and take the statins. I don't want to be told that.
Right.
Did you have anything else you wanted to share before I close out this session?
If people don't take this serious, I would say just one thing: keep your vitamin D level up. Because as long as you keep your vitamin D level up, you're less susceptible to viruses and bacteria and all those different things, which is another reason for Cardio for Life. Cardio for Life increases your T and B cell count. That fights bacteria and viruses. Nitric oxide prevents blood clots. The current virus that's going around now, people are dying from blood clots in the lung. So taking arginine-derived nitric oxide and vitamin D, and vitamin C, that'll keep you nice and healthy, and your longevity will be greatly benefited.
So I increased my normal vitamin D supplementation prior to the pandemic was 5,000 IU a day.
Mm-hmm.
I upped it to 10,000 IU. I know we're not giving recommendations to specific people on this video, but is that a range that seems reasonable to you?
Yeah, they recommend that. I think it's common that 5,000 IUs a day. Cardio for Life has 5,000 IUs. I actually do a double dose twice a day and take additional vitamin D. I don't believe that you can have too much vitamin D in your body. When my vitamin D level was checked when I went for this Medicare visit, it was 78. Now that's optimal to me. To the doctor, I said, wow, that's really high. Well, to me, that's great.
Right.
People under 20 are where the problems are. So, keeping it up around 40 or 50 is where you want to be. And I'm at 78. I was happy with that.
In our next session, what I'd like to do is a little more on nutrition and then get into the digital pulse wave technology and really explore that thoroughly. Dr. Garey, I just can't thank you enough for being with us today. And I really appreciate all the information and the guidance that you're giving us.
Okay, well, it's great being here.
It's fascinating that you're so approachable, easy to reach on the telephone. When people have questions, they always say on those commercials on the TV, if you suffer symptoms, side effects from a medicine, to call your doctor. And I don't know anybody who can call their doctor. You might be able to get an answering service. You might be able to get a call back from a nurse, but it's really hard to call your doctor if you're having an issue. And you're so approachable and so easily accessible. I really appreciate it, Dr. Garey. So in closing this out, I just want to say, if you go to fullbodyhealing.com, click on the link to get to Dr. Garey's website. I'll give you a free health assessment checklist, which is a tool with my compliments that will help you to identify where you can make improvements in your health. Now, this is a form that can be used also as a initial consultation with a health coach like me, but it can be used just for you personally to identify where you want to make progress. And then if you need a health coach to help you sort through any of the issues, that's what we're here for. Get to Dr. Garey's site. If you order Cardio for Life, let me know that you did, and I'm going to give you another gift that will help in your health journey. Very happy to do that. It's Gary Simmons, Full Body Healing, and OptimalHealthBridge.com. Looking forward to speaking to you soon. Hey, I want to congratulate you for sitting through and listening and learning. Over here we have the video library. It is called the Knowledge Library, chock full of really interesting things that you can continue learning.